it's really great. Just to walk around here and see how primary care has evolved. I was saying to the commissioner that I remember when we used to refer people out for mental health care, and then I remember when we thought about putting a couple of rooms on another floor for behavioral health to refer people to primary care, and then I remember, thinking, well, maybe we should really be doing this here at the health center, and now we're building our places with integrated behavioral health and care management and primary care all in one location. It's really, things have really evolved. And now we're even putting the staff in one space in these care centers. I hope y'all, if you haven't had a chance to look around, that you'll have a chance to walk around and sort of see what that looks like when it all sort of comes together in the care of people.
And I am so thrilled to be at such an important cause and such an important community resource that helps people in the district I'm privileged to represent. And I'm so pleased to be here with not only Dr. Neil Carolyn, and I thank you for inviting me to speak, but more importantly, providing health care to over 117,000 New Yorkers each year. There are 5 centers in the district that I represent now that he has founded. This is going to be the 6th. And he told me earlier he really runs 30 community health centers from which I had never heard a complaint. I've only heard that I'm so glad to help you. Now that's an accomplishment. That's an accomplishment. And that sort of and he told me earlier that when he started, there were 3 of them, and they had a vision of a community health center, and they started one, and now it's grown to this this whole galaxy of services for people. And it reminds me of that quote from Margaret Mead where she said, "Never believe that one person can't make a difference with a few friends. Indeed, that's the only way change has come." And I would say that he's certainly brought change, and helping him is Rose Dunham, President and CEO of the Community Health Care Association of New York. Thank you for your work. And it's always my honor to be with one of my heroes, Dick Gottfried. I was like an intern when he was elected, and I was like my dream in life was to get on the staff of Dick Gottfried. He was always doing all kinds of great things when I worked for the New York State Assembly. And when he put in his health care bill for all, it was considered radical. Now he's gaining steam. It may pass in the New York State Legislature, and I would say his bill, or one very similar to it, in Congress now has well over half the Democratic members of Congress are supporting it, and he has been an extraordinary visionary in terms of health care and providing the structure and funding and ideas of expanding it. And I know my colleague Senator Hoylman is going to be your state senator, or so he told me last night. And Commissioner Zucker, we thank New York State. I think New York State is a success story in healthcare. We did it. We got up our exchanges. When they cut back all of the help for open enrollment, when they cut back ideas of getting people involved, the state and the city came in and filled that void, funded it, reached out, and got people part of the Affordable Care Act. I would say the Affordable Care Act had many important parts to it, but one of the most important parts was the community health centers. And I've got to tell you, you know that when you do legislation, we're a 3-legged stool. You've got the House, the Senate, and the President, so you negotiate. And for some reason, when they come back, they were always cutting the community health centers out. And the Democrats would say, no, we want it back in, we have to have it, that's what serves our communities, that's what we want. And we were so pleased that the Affordable Care Act included funding and expansion for this important resource. And it really is the main way, and I believe in the future will be the main way, as they expand for people to have access to affordable and available health care. They're not, when you go to the community, when you go to the emergency room, you wait forever. Most people can't afford private doctors. This is really becoming the basic source of health care here in New York, in my district, and around the country. And this facility alone will offer primary medical care for children and adults, including preventive care, women and men's services, mental health services, and health education and care for chronic illnesses, including diabetes and HIV. So we are so thrilled that we did keep the community centers in the Affordable Care Act. And the Affordable Care Act also increased funding for the Community Health Centers Fund, which accounts for 70% of federal grant funding for community health centers. So we greatly increased the funding that is there. And according to a 2017 Kaiser Family Foundation report, health centers in states which expanded Medicaid served 40% more patients than those in non-expansion states. Wow, that's incredible. And why aren't all states doing that? I want to say that it's unfortunate that the reauthorization for this funding was held up this year, but I'm glad that it was increased to $3.8 billion next year and $4 billion for the following year. And I can't think of a better investment than investing in affordable and available health care. And just over the past year and a half, I've had to spend, I'd have to say, 3/4 of my time defending the Affordable Health Care Act. For some reason, they put it on the floor, and you go down, and 64 times I have voted against defunding the Affordable Health Care Act. I don't understand how anyone runs for office saying, vote for me, I'm against health care, I'm going to take away health care from 30 million Americans. But that's exactly what the debate is in front of Congress, and it is a fight right now to hold on to it. So elections have consequences, and we need to make sure that people are elected in whatever party that support the affordable health care and health care for all. In 2016, 35 community health centers across my district, 6 of which are his, or yours, received over $48 million and served over 390,000 people. That's quite an accomplishment, really. And the Institute for Family Health accounted for 6 of these right now, 5, and now this is the 6th as I understand it. So I want to thank you for all that you do, and they always say that an apple a day keeps the doctor away. but who wouldn't want to come and visit this beautiful health facility? I'm going to say I almost feel like getting sick so I can stay here longer. But I've got to get back to work. But I just wanted to come back and congratulate people on the front lines that are providing this health care, the staff and everyone here, and giving health care to people who deserve it in our great country. You're really doing God's work. Usually I'm in Washington. I'm so glad I'm here today so that I could be here to congratulate you and to thank you for the incredible work that you're doing every single day. And I think we should get out and tell this story. I don't think people realize the incredible work that your institute is doing and other community health districts, because you're really the backbone of health care to our community and to our families. So thank you so much for having me.
Thank you, Neil, and thank you for the warm introduction. Thank you, Congresswoman Maloney, for all that you're doing in Washington. Assemblymember Gottfried, it's a pleasure to be. I know Senator Hoylman is going to be here at some point. I'm here this morning really to be here on behalf of Governor Cuomo, who is really committed to working so hard to champion healthcare in the system, not just here in the standpoint of one community, but for the entire state, and to help all New Yorkers get the access to quality care. It was Governor Cuomo, along with our elected leaders who are here this morning, who stood up and demanded that the federal government restore critical funding to programs when it looked like this was going to disappear, and that was very concerning. Healthcare centers like the Institute for Family Health provide high-quality care to 2 million New Yorkers, and this is an area, we were talking about this before, how concentrated this area and how many people need health care. And it's institutes like Family Health that really are doing exactly what needs to be doing. It's one of the largest federal qualified health centers in the state, and as you heard from the Congresswoman, over 117,000 New Yorkers are cared for. Yeah. Dr. Carolyn and I were together in the Public Health Week a couple weeks ago. This was upstate New York in Ellenville. Now, Ellenville is different than New York City, as we know. But the fact is that what the Institute is so great is that even though the areas are different, this service, what we're trying to achieve is exactly the same, to make sure that someone can come in and get the care they need. And we walked around earlier, the concept of behavioral health and physical health tied together is true. Years ago, this was completely a separate issue, and we're pulling this together. The Institute obviously has pulled together issues of mental health, physical health issues, HIV/AIDS, all the different areas that we need to address. The Institute also has a long history of working to address health disparities and responding to the emerging community needs. That's really, in many ways, the core of the functions of what we do in the department. Dr. Carolyn and the Institute should also be commended for their innovative approach and programs to advance primary care workforce shortages. And this is one of the big issues that we're dealing with. Issues of the diabetes epidemic as well, and increasing access to contraception and family planning, which is really important. Obviously responding to the opioid crisis and all the things that we have that we're dealing with there. And providing a safe space for survivors of human trafficking to receive health care. There's so many different issues that we have. And it's nice to have a strong partners in the program as we move forward on these issues and to advance Governor Cuomo's priorities and the issues that he wants us as the Department of Health to move forward. At the end of 2017, the American Health Rankings came out, and New York State was ranked up from, originally we were up at 10, but originally in 2008, we were at 26, and before that we were at 40. So we really have moved up. We will get to number one, we will get to the top. But we were up from, I think we were number 40 in 1990, so in the course of a period of time. But it's all the hard work of institutes like this and work, not just here in New York City, but obviously all across the state that are moving us forward. And we're grateful to the work of all the practitioners, to your board, to Dr. Kelman, and to everyone else who's really committed to the leadership in Washington, leadership in your leadership in Washington, and leadership in New York State, the Assembly and the Senate level. So I'm here to thank you all for all that you do to help make our work easier as we move this forward to help so many people in the state of New York get care.
There was an astonishingly coordinated campaign among primary care physicians to get New York State to really dramatically ramp up what we do for primary care. I mean, as one of the targets of that effort, it was quite a thing to behold. People were coming at me from all over the place, and amazingly, all with the same agenda. And it worked, by the way. And one of the key lines of argument that was used was, and I guess in medicine they do this a lot. For some treatment, you think of the 3 R's or the 4 P's or whatever. That's how medical students remember this. So they have 3 P's: people, places, and payment. People meaning you got to get people to train as primary care practitioners and family practitioners and pediatricians and stick with it. Lots of people go into medical school dreaming that they're going to do that, and then it gets beaten out of them, and they come out as, specialists in surgery of the left hand. I once had surgery on my left hand.
That's how you know.
I was glad that somebody. Funny story. Not for today. And it takes a lot to help get people into primary care. And one of Neil's focuses forever has been promoting getting more medical students, graduates into residency programs for primary care, family practice in particular, and he's really done amazing things in promoting the growth of that. Places meaning practice settings where people can do primary care, and community health centers, the Institute for Family Health, outpatient facilities, and the like, and support for individual and group practices is really very essential. And community health centers, I think, are about the most amazing part of that whole venture. And I think we are going to get to an era where it's not just someplace where people who need someone who will provide them care, even if they can't pay for it, all of us will want to be going to community health centers. And then the last is payment. Because, you know, if people aren't paying for the residency programs and paying fair reimbursement rates for people who do primary care, none of this is going to happen. And you know, part of Neil's job is making sure that people like me and Carolyn and Dr. Zucker and our colleagues focus on making sure that government does its part to make that payment available. And so, you know, today is a celebration of this particular facility, but I think it's really a celebration of all of the amazing work that Neil and his 1,400 colleagues have been doing to advance primary care training and primary care practice and its integration into the whole system to make it really available to every New Yorker.
Statesman Brad Hoylman, I just wanted to thank my colleagues and Neil and all the team here, your 1,400 strong staff. You know, I think of my district, and I know Dr. Zucker is familiar with it. Of course, the Congresswoman and Dick Gottfried share it with me. How rich it is in so many ways. It's an embarrassment of riches, as they say, in terms of culture, health, business. I mean, Twitter, the New York City Twitter headquarters is literally right across the street. You can see them here. So it suggests to me that we're very fortunate here in Chelsea and in Manhattan in particular. We're fortunate because you're moving here from Union Square to this location, so I want to thank you for that. We're fortunate to have Dr. Zucker at the helm. The work he's been doing, particular interest of mine, representing this district and the community from which I come, is AIDS and HIV research, and the plan that Dr. Zucker has put forth to eliminate AIDS, HIV in New York is phenomenal and one of a kind. I'm also very blessed, not only with Congresswoman Maloney, but of course Dick Gottfried, both two strong, well, regarded and really kind of landmarks in their own right in terms of healthcare advocacy in both instances. And then there's me. So, I come from, the state Senate, where we're deadlocked at 31 senators who sit with the Republicans and 31 senators who sit with the Democrats. And the reason we can't come to any agreement is over a healthcare issue. It's over the right of women in New York State to have an abortion law that reflects the values of New York and moves it out of the penal code into the health code. And some of my colleagues across the aisle don't want to do that. So it's really interesting to me that while we had all these amazing assets, how much more work we have to do to educate politicians like me as to its value. But I want to tell you that I recognize it, and I'm very fortunate again to stand in the presence of such greats, including our Council Speaker Corey Johnson, who I know couldn't make it today. But thank you very much, Neil, for the work you're doing. Thank you for supporting families. I, for one, am a little late today because I was on a school run with my 7-year-old at PS41. But I'm very proud to be here and very proud to stand with you and your staff on this very, very happy day. Thank you.
Thank you, Neil. And first of all, I just want to congratulate the staff, the leadership, the board on the tremendous work you do every day to make sure that everyone gets the health care that they deserve. And this facility is a great example of the work that you do to ensure access to health care. As you know that Neil is the president and CEO of the Institute. You may not know that Neil is currently the chairman of the board of CHCANYS, the Community Healthcare Association of New York State. And as Neil said, CHCANYS' purpose is to ensure that every New Yorker, and particularly those who face barriers and challenges, have access to high-quality primary care in the communities where they live. And Neil has truly dedicated his life to that mission. And I want to thank Neil for his leadership and his vision in guiding the Institute and in guiding CHCANYS, and really in his role in shaping healthcare in New York State. So thank you very much, and congratulations to everybody.
So I've been with the Institute over 30 years, and I've actually practiced in this neighborhood for 30 years. And I think one of the things about my career, I really feel fortunate, and I think the message, and thanks to the leadership, is the importance of relationships and trust in being able to provide care, especially to people who need it. And part of what I'm so grateful for, and I think what I'm really committed to, especially to our training programs, what the Institute provides, is a career path for people to stick with working in community health centers, because right now there's so much fragmentation with urgent care facilities. There's so many parts of the healthcare system where people get turned away. And one of the things that I'm so proud of about our organization is, if you need help, come here. And to be able to have a staff that can respond to that, we're really grateful. So that's what sort of today is, not only to kind of acknowledge the fact that we've made this somewhat painful transition. You know, in New York State, in New York City in particular, you're frequently moving from one larger space to a smaller space, and so space is a challenge. This, you know, we were in 6 floors and we moved to 3 floors, so there's been a little bit of dealing with some elbows, particularly sharp ones sometimes. So today is really sort of a celebration of what we've been able to accomplish, so I'd like to acknowledge some of the key people. First of all, Dr. Amy Pandya, who is a medical director, and is our associate regional director, and our new medical director, Dr. Ginger Gillespie. Yeah, you need to come up. What's also unique is the integration with our behavioral health leadership. I mean, this is for people who are sitting in this rate, this is quite unique to have a waiting room where people who are receiving primary medical care and behavioral health in the same waiting room. It's really because of our behavioral health leadership that we're able to accomplish that. With Giorgio, Charlatan, Laura Myers, Jason Warchowski, and Rebecca Levy. Can you guys come up? Our nursing leadership, Valentina Obenenko, who helped us in this transition when she was at 16th Street. Now she works at our new cabin site. You can come up. Our administrative leadership with Justin Cortijo and Fermi Leon. Our management with Laura Bizarri and Haley Nelson. We need a bigger waiting room. Our Compass team, which is really our HIV team, Rebecca, Lushevsky, Teresa, and Jesus Lopez. And finally, this is actually a training site for one of our residency programs. And part of what we've been able to do, and part of the thing that I feel so passionate about, is community health centers should be the place where people learn how to practice medicine. This should be the classroom of the future, where nurses, doctors, therapists, because learning how to work with the community and realizing that this is a place where you can have a career is so crucial. So I want to acknowledge Dr. Andreas Corson, who's a program director. Who's a program administrator. I don't know if he's here. Anyway, so this is a small representation of the 1,400 strong that make this happen. It's just a pleasure to work with you guys, so thank you. Congrats.
So we're gonna break tradition a little bit, because I really wanted these guys to cut the ribbon this time. And so we're gonna do 2 ribbon cuttings, but you guys should get to do it first. So.